Good morning, and thank you for joining us today for a very special announcement. I'm Mecklenburg County Manager DENA DIORIO. Over the last several years, Mecklenburg County has focused on behavioral health in an effort to improve access to services and provide a higher quality of care for county residents. As you may know, we recently transitioned from Cardinal Innovations to Alliance Health, which was in a significant step towards this direction. We also know that the pandemic has impacted our mental health, and the county has implemented the Mec Home program in an effort to respond to this very critical issue. Now today, the county is ready to announce the next big step towards making mental health services available at even a greater capacity. I'm pleased to introduce Mecklenburg County Board of County Commissioners Chairman George Dunlap to share the details of the county's latest venture.
First, let me say thank you, DENA, for your introduction, and thank all of you for joining us here today. This is a special day in the life of Mecklenburg County. Before I begin, I'd like to acknowledge Steve Smith, Jr., President and founder of the Steve Smith Family Foundation, Steve, and also acknowledge Rob Robertson, who is the CEO of Alliance Health, and Billy West, who is the Executive Director of Daymark Recovery Services. Thank you all for joining us as well. In fiscal year 2020, the Mecklenburg Board of County Commissioners designated mental health as one of its top priorities for improving the wellness and livelihood in Mecklenburg County. Since that time, the county has allocated more than $15 million in funding contracted behavioral services towards our mission. Funding to provide comprehensive assessment and therapy for marginalized populations, case management for youth and young adults, programs for people with developmental disabilities and substance abuse treatment for individuals experiencing homelessness or being released from jail. We've also funded staff to coordinate behavioral health services for Charlotte-Mecklenburg schools and our Sheriff's Department, as well as clinicians to support the work done with public health and our other county departments. Today, I am proud to announce a new partnership with the Steve Smith Family Foundation, Alliance Health, and Daymark Recovery Services that will allow Mecklenburg County to provide even more mental health services to support the community. Through the launch of the Smith Family Behavioral Health Urgent Care Center, the Mecklenburg County Behavioral Health Urgent Care Center will be the first of its kind in Mecklenburg County to focus solely on behavioral health needs. The Smith Family Behavioral Health Urgent Care Center will offer patients with urgent behavioral health care needs an alternative location to receive triage and referrals instead of having to visit the emergency room of our local hospitals. The BHUC will be a full-service behavioral health urgent care, providing more robust behavioral health, from mental health assessment and evaluations to crisis counseling and mediation management. The Smith Family Behavioral Health Urgent Care will also provide referrals to mental health and substance use outpatient treatment. This is an important day for the residents of Mecklenburg County as we continue to find innovative ways to support the needs of our community. Our mission could not be accomplished without the support of our partners. I would like to personally thank Steve Smith and the Steve Smith Foundation for their desire to collaborate with us on our efforts to support mental health needs within the community. Please join me in welcoming Foundation founder and former Carolina Panther, Steve Smith.
Thank you very much. This is a great morning for our city, for our county, for our state. Back in March 2021, I had the opportunity to meet with Anthony Troutman. There was a good friend of mine that had spoken to Anthony, or Anthony spoke with him and said, "You need to speak with Steve." A good friend was Rocky McGregor. And Anthony approached me and asked me, can we add services to what we were already doing? Anthony did his due diligence on understanding what the Steve Smith Family Foundation was already doing. He wasn't asking us to change, he was asking us to add. And because we were already in existence. And by doing that, we had breakfast. And over 2.5 hours of that breakfast, we discovered that adding services would be doing mental health a disservice. And so we decided, or I decided, after meeting with Anthony, that the only way this would be effective, impactful, and leave an imprint on our county is by having it be a standalone. And that was a big endeavor, and it was also one of those beliefs that if you dream big, then things can happen. Well, without me dreaming big to want to play in the NFL, I would never have the opportunity to go to college, to meet my wife, and to get drafted by the Carolina Panthers, and 20 years later to be sitting in front of the county to tell what we are investing into this community by services. I've watched a little bit of news and everyone says this is a gift from Steve Smith. This is not a gift from me. This is a collaboration from the county. This is a collaboration from my staff, the Steve Smith Family Foundation, from all the other programs and services that we've discovered that this county and city and state needs, to understand that this is a collaboration with Daymark and Alliance in working to serve our county in a way in mental health that has never been served before. So this is not a gift out of my pocket. This is sweat equity into this community that gave me sweat equity back in 2001. So this is an opportunity for us to, as a community, to gather each other, support each other. Since we've made this presentation to the county, there have been a lot of hours since March of visiting and understanding what behavioral health needs, what it deserves, and what it needs to do is come out of the shadows of shame and come in the forefront to say that I need help and there's nothing wrong with me and I'm not alone. And so by doing that, using my platform and saying you are not alone, because I've had depression. I've had questions of, am I good enough? And today is a press conference to say, one, yes, we are good enough. No, you no longer are alone. And yes, we will make a change. Thank you.
Now I'd like to introduce Rob Robinson, Chief Executive Officer of Alliance Health.
Thank you, Manager DIORIO, Commissioner DUNLAP, and Steve. Good morning, everyone. I bring greetings from the more than 800 dedicated professionals at Alliance Health. As your local LME MCO serving Mecklenburg County and the Triangle region, we were responsible for helping to ensure care for people with mental illness, substance use disorders, and intellectual and developmental disabilities who have Medicaid or do not have a means to pay. Alliance has a proud tradition of collaborating with local governments and other stakeholders across the counties we serve to help citizens in our community enjoy healthier, more satisfying lives. And what an outstanding example of collaboration for which we are here to celebrate today. We are grateful for the opportunity to work with county leaders, the Steve Smith Foundation, Daymark, all who have made such a tangible, compassionate commitment to the mental health of our citizens. Steve and the county shared with me their concern about the lack of accessible health care for people in this community experiencing a behavioral health crisis. We are in agreement that behavioral health urgent care centers, or BHUCs for short, are an important piece of the puzzle to addressing this health access gap. BHUCs are much like the physical health urgent care facilities you see on many street corners these days. They can provide immediate care for individuals experiencing or on the verge of experiencing a behavioral health crisis. The goals are to stabilize people in need, allowing hopefully a return to home, but at minimum prevent unnecessary trips to the emergency room, other out-of-home placements, and even incarcerations. So thank you to Steve and your team for your vision, to Mecklenburg County, Commissioner DUNLAP, and Manager DIORIO for your critical support, and to an outstanding provider in Daymark for your partnership in making the BHUC a reality. This is a special project that will be of tremendous value for the members of this community, and I am delighted to be here today and eager to get this work started. Thank you.
Next, we will hear from Billy West, Executive Director of Daymark Recovery Services.
Thank you for having me here today, and I want to thank the Steve Smith Family Foundation, Mecklenburg County, and Alliance Health, because without them, we certainly would not be here today, and I dare say we wouldn't have a behavioral health urgent care come into Mecklenburg County. Just a few words about Daymark. We treat a lot of Mecklenburg County residents, but not right here in Mecklenburg County. We are a not-for-profit. We are in 30 counties in North Carolina, including the counties contiguous to Mecklenburg County. And we have 3 of these behavioral health urgent cares, and or as Rob said, BHUCs. On top of that, we have 5 additional inpatient units for adults and 2 others for children that often work hand in hand with a BHUC. I'm going to leave you with a gift of brevity and just say thank you very much for having us here.
At this time, we would like to open the floor up for questions from the media, if there are any.
Yes.
Why did you decide to do this? Was it something personal, something within your family? Why did you tackle this particular situation?
Well, that's a great question. One of the reasons with our Smith Family Wellness Center during the pandemic, we have received over 1,900 serviceable counseling hours. That was the first time in our existence that our counseling services outperformed or outserviced just our regular medical appointments. In 1,900 hours in really mental health or counseling, that's a lot for over 6,000 patients that we already serve. So that just kind of showed that there was metrics and numbers that really showed it wasn't something that we thought it was a great idea. The numbers said, the data, it said this is something that needs to be addressed. For myself personally, throughout my years of playing in the NFL, you know, I did some counseling. I had a sports psychologist and addressed how to perform under pressure. But then also knowing some of the things that I experienced growing up in Los Angeles that I had never addressed. And by not addressing those things, I was suppressing them. And at different times, there were different triggers. And so just going through, really assessing myself if I'm going to be conducting how I eat, my sleep patterns, my carb intake, you know, dairy, all those other things, performance, physically performing, going and having a trainer, having a sports psychologist. Why not finish off the whole package on my head and my heart? Right, and so that's why, that's what I had believed once I was near the end of my career and then throughout my retirement. And so I just felt that it was a need, and that was why. Yes, sir.
Have you guys come up with a location for the?
Yes, the location was picked. It should be on Independence. The location was picked based on geographical location of our clientele. which is the max of 2 bus rides here locally from the east side or the west side, making it accessible and understanding, obviously understanding the county and what everything is going. One of the biggest issues when we visited Daymark out in Forsyth was a lot of people who could afford would drive to Forsyth. We have to make it affordable and take away all the barriers of getting them into the door and them feeling eased that they can get there and leave easy accessible. And so Independence was that place. Yes.
For someone who may not need these resources immediately, why should they care that this is coming from Mecklenburg County?
Because, well, that's a fantastic question. If you wait until someone needs it, then it's already too late. You built these services because you never know. It's like anything else. You don't get to pick what storms come in your life. Now, you have to have the people around you and a support system, and that will be friends, but it also deems to become a friend, you must first start as a stranger. And so that's why these services are needed. We're not asking you to have a problem. We're telling you, if you have a problem, we're here. And you are important, and we are thoroughly concerned about it, because it may not be you, but it may be your sister. It may not be someone else. It may be your wide receiver for your local team who's battling with depression.
Is there an idea of how many people you guys expect to help on a monthly basis, according to your own data and your own research?
According to our own data and our research, I believe we thought we were, what did you say, Billy? 70, 75 people a day, possibly, but I told him, he said 75. 75, Billy at Forsyth believes 75. Now, I know Forsyth is a booming place, but down here in Mecklenburg, I think we'll see a little bit more.
I think the other thing that we really need to keep in mind is that we need to do a much better job of destigmatizing behavioral health needs and behavioral health services. And so the more we have an opportunity to put these services in our community and make them accessible for people, people will take advantage of them. We just saw earlier today about Chelsea Christ, who's from this area, who clearly had some behavioral health issues and took her life. But, you know, and that's tragic. And if we can put this in our community and prevent one person from being so desperate that that's what they have to do, then that's a victory for this community. So again, we want to thank everybody for being here, and we're looking really forward to working with Steve Smith's Family Foundation and Daymark to bring this center to this community. So thank you.